Yeah,
Time to
that's,
hear.
no,
Good
so
morning, everyone.
I-
Welcome to the
I didn't wanna take the time.
December the 2nd Health and Human Services Committee meeting. And we will begin the meeting, waiting for the chairman to get here, but I'll start the meeting. We'll start today with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
I was gonna say, yeah, there's a.
Chairman Lassenheiser has been delayed, but he'll be here in a few minutes. But just to keep things moving, I would like to, we have the agenda in front of us. Any changes that you've got?
There are none.
Your wishes?
So moved.
Hanson, Pearl, Wright. Questions or comments? All in favor?
Aye.
Any opposed? Thank you. The minutes of October the 7th. We did not meet in November.
I move minutes
Pearl,
October.
Pearl Wright moves the minutes.
Support.
Supported. All those in favor?
Aye.
Aye.
Any opposed? Thank you. We have a fairly extensive agenda today for this committee. And we will start with Kate from Tri-County Aging. She will be giving her semi-annual report for TCOA.
Thank you for having me. Like Blake said, I am Kate from Tri-County Office on Aging. First of all, we want to thank the county for your ongoing support. We also want to thank Commissioners Mulder, Moudry, and Pearl Wright for your attendance and your support on the TCOA Advisory Board or Administrative Board. TCOA continues to have staff presence on the Eaton Vulnerable Adult Network and Eaton Human Services Collaborative Council meetings. Thank you to Paula Jensen and Sue Hoffman, Eaton County residents, for their involvement on MSAC, which is an advisory group through the Area Agencies and on Aging Association of Michigan. On August 16th, the Commission on Services to the Aging approved the fiscal year 2025 annual implementation plan for TCOA, and this document can be found at tcoa.org/documents. Also, save the date for May 7th of 2025. This is Older Michiganians Day, a day of advocacy on issues that impact older adults and caregivers, and we will share more information on that in 2025. On August 9th, TCOA hosted a 50th anniversary celebration. Thank you to Jeannie Pearl Wright, who attended. And our advisory council, the TCOA Advisory Council, acts in an advisory capacity to the consortium board or the administrative board. Thank you to Ruth Pearson and Sue Hoffman, who represent Eaton County. There is currently one vacancy for Eaton County, and recommendations can be sent to Casey Cooper. The Aging and Disability Resource Center and Long-Term Care Collaborative. The Long-Term Care Collaborative continues to gather information to better understand how homelessness and other housing issues are experienced in our communities in order to identify future projects for the group. Long-Term Care Collaborative members have begun exploring opportunities to bring a recuperative shelter to the community, and the Long-Term Care Collaborative meets bi-monthly. Service data shared moving forward reflects fiscal year 2024, which is October 2023 through September 2024. For information and assistance, 13% of INA calls were from Eaton County residents. TCOA also contracts with Capital Area Community Services for additional support in the Tri-County area. 20% of INA calls through CACS were from Eaton County. Community Resource Navigators. TCOA's 2 Community Resource Navigators connect underserved communities with existing resources and assist clients in overcoming barriers in health and social services while addressing social determinants of health. 12% served were from Eaton County. TCOA formally ended the Friendly Reassurance Program effective August 1st, 2024. The Retired Senior Volunteer Program, or RSVP, offers friendly reassurance to older adults throughout Clinton, Eaton, and Ingham counties and is a referral partner for TCOA. Participants and volunteers were made aware of community resources during our wrap-up period. For nutrition, TCOA served 73,500 meals to 378 Eaton County participants through the Home Delivered Meals Program. And due to sustained high demand in Eaton County without additional funds to support it, beginning in February 2024, TCOA did implement a waiting list in Eaton County. There are currently 87 Eaton County residents on the waiting list. The TCOA Senior Dining Site at the Delta Township Enrichment Center, or Delta 39ers, continues to offer dine-in service as well as carry-out meals 3 days per week. TCOA has served more than 2,200 meals to 16 Eaton County residents through the Congregate Senior Dining Program. We continue to work toward reopening the Grand Ledge Dining Site. The biggest barrier is volunteer recruitment. So if you have any ideas, we're open to that as well. We are also considering alternative meal options such as a soup and salad bar or a breakfast option to try and bring in more people. TCOA is primarily offering health and wellness workshops in person, but we are still offering workshops online as well. TCOA completed 12 workshops in person in Eaton County. In addition, we completed 5 online workshops, and a total of 128 Eaton County residents enrolled in a health and wellness workshop last year. TCOA Medicare and Medicaid Assistance Program staff and volunteers provide Medicare and Medicaid counseling, and they provided that to 1,428 beneficiaries last year. Of those served, 282 were from Eaton County. Project Choices offers a community alternative to nursing home care, and TCOA served 438 people from Eaton County through My Choice, care management, and case coordination, with an additional 311 Eaton County residents waiting for in-home services and supports. The need for volunteers agency-wide, particularly Meals on Wheels delivery drivers, continues. Anyone interested in volunteering is welcome to contact TCOA. And then just a couple events that we have on our list here. We had our 39th annual dinner and auction on Thursday, November 21st. It was a great night with over 350 people in attendance, and thank you to Blake who attended that as well. We also have our coming up next year, 37th annual Meals on Wheels golf outing on Tuesday, June 11th at Forest Acres West in Lansing. And I'll take any questions. Okay, thank you.
Thanks, Kate.
My apologies for my tardiness. I appreciate Blake getting us going. I believe that brings us to Callie. Oh, thank you.
Hello, I'm Callie Dempsey. I'm the co-executive director of Eaton Community Health, and I'm the current chair of the Eaton County Human Services Collaborative Council. I'm also the current chair of the one of the sub-work groups of the HSCC for the Continuum of Care. Thank you for inviting me today to give you a brief update on all that's happening in the Eaton County HSCC. Thank you for all of your support from this group and from all of our commissioners who participate in one or more of our action teams. So I have a couple of updates on the work that we've been doing together, but I wanted to start with just a high-level update of the radical transformation that has happened over the last 4 years here in Eaton County in the Human Services Collaborative Council. So prior to 2020, the HSCC was a monthly meeting primarily for local leaders to share updates about their agency's work. And since 2020, we have adopted a new methodology and a new framework that is called Collective Impact. We've developed a vision, a shared vision for a healthier Eaton County, which informs our collaborative council's work. We also formed a steering committee, and we have refocused our monthly meetings on interagency cross-sector collaboration. And so since 2022, all of the HSCC meetings have been used to bring staff of all levels, agency leaders, middle managers, and frontline staff, and Eaton County residents, together to collaborate on the action team projects that are in alignment with our HSCC shared vision. And so when I brought some handouts here so that you can have a layout or a good graphical understanding of what I mean when I say collective impact. This is This is a new strategy and methodology to our work, and a collective impact approach improves outcomes for all residents. We're really proud of the work that we're doing together in this, and it makes collaborative councils more effective when they're focusing both on connecting with one another and changing and shifting community conditions. So we have been working with, part of Collective Impact is to form a backbone team that helps to guide this work, and we're doing that with a renowned system change consultant, Dr. Penny Foster Fishman, who has been really working together with our county for the last 4 years. You can see here in this chart what happens or how collaboration as usual happens, and then how collective impact can begin to shift some of the community conditions that we see. And then examples of how the Eaton County HSEC has started to embed the collective impact framework into our work. That we are working together collectively, cross-sector, really diverse sectors to create a shared vision that we're doing our work around. That we are active, HSEC includes members from all levels of the organization. That we're regularly gathering input from residents and frontline workers to inform vision and strategy development. We call this or refer to this as radical listening. We're just finishing our second season, if you will, of radical listening, where we have sent out frontline worker surveys to frontline workers here in Eaton County to better understand what it is like from their perspective, what barriers they're finding to meet their clients' needs, what is it like to work here in Eaton County, what are the things that are working really well. We heard from about 130 frontline workers on that survey, and then we launched the resident survey shortly after. I believe that we just closed our resident survey at the end of November, and I believe that we're at a little over 300 resident survey input to help, and then we'll bring that data back to these action teams, and we'll begin to do data sense making together, and that will help to guide our work in this phase 4 as we move forward. We also have our action teams focusing on quick wins and continuous learning, so we don't ever approach a barrier or a problem in our service delivery world here in Eaton County thinking that we know the solution. We're coming together every month as a group and we're doing continuous learning and then adapting to that learning as we work through our action team work. Just quick engagement data for you, that we have about 88 engaged members of our HSEC that represent 38 organizations here in Eaton County. Our average HSEC monthly meetings includes about 30 participants each month, which is double the engagement that was happening prior to 2020. We have 5 work groups that are a part of the HSEC that we stay continuously engaged and connected with. Our Child Abuse Prevention Council, our Eaton County Continuum of Care, the Eaton County Substance Awareness Advisory Group, the Great Start, and the Vulnerable Adult Network. And then since 2020, we have formed a steering committee, and the steering committee helps to guide and help make decisions on behalf of the HSEC. And the agencies that represent our steering committee right now include the Barry Eaton District Health Department, CMH, Eaton Community Health, our Eaton County Commissioners, Eaton RESA, DHHS, and Mid-Michigan Housing Services. So we're really excited about the level of engagement and who is being engaged in this work as we work together to make Eaton County a healthier community. You'll see I left with you guys a vision of our graphic of our shared vision. These are the buckets that we're working under. You can see our vision statement and the mission statement that we've developed together, and then the framework that we're following here for our shared vision. Our action teams right now, we have 3 that are working together every month, and they're working under 2 of these buckets on the shared vision right now. One bucket, there's 2 action teams working under easier to access services to make it easier for residents here in Eaton County to access the services to meet their basic needs, and for frontline workers to be able to do their jobs in the most effective way possible. And then we also have a team working under basic needs met. We bring these teams together once a year for an in-person celebration, and we get to hear about the work that's happening on a larger scale together and get really excited and celebrate the wins that have been happening. I left you guys with an action team summary of some of the work that we've done in phase 3. We're just getting ready to kick off phase 4. What's really exciting about this work is that we're beginning to partner on a regional level with some other collaborative councils, and the work that's been created by our action teams is beginning to be adopted on a regional level. So our focus is always at this local county level. And we understand that many of our agencies here in Eaton County are tri-county agencies. They have staff that are working in the region in multiple counties and residents who are accessing services in multiple places. And so we've begun to collaborate really closely with the Power of We in Ingham County and not duplicate efforts. We're learning and working together and helping to meet the needs of residents throughout the region. So some of the big wins that we've had over the last year is the Easier to Find Services team has been really working on trying to make the 211 system more accurate and precise so that residents who are in need of a resource have an accurate, quick way to get connected to that resource. And they are launching next month in conjunction with the Power of We. They'll be doing a in-person 211 agency updater event where we'll have 211 on site. There'll be a training on the new software portal and the new updater portal in person, and then agency updaters will be able to update their agency information during that event. They'll also be able to get to know one another and begin to connect with one another. We've heard from frontline workers over the last year that they really have become disconnected over the last few years, and there's an eagerness to be able to have more robust relationships with one another, to know who they should be referring their clients to, how to refer their clients to the right resources. And so we'll include some networking in that training, and the Power of We and the Clinton County Collaborative Council are also invited to that event. We'll be doing that at the Eaton RESA. They created a really cool common terms 211 guidebook that can be used by frontline staff to quickly find the right resource in 211. There's been, we've identified that the language difference between what 211 refers to certain resources is a lot different than the language that a Eaton County resident may use when they're seeking help with a water bill. And so the frontline workers have been using this guide to help them make sure they're getting people connected as quickly as possible. We also have a landlord engagement and affordable housing action team. They've spent the last year developing an education session for area landlords to better understand the affordable housing programs that are offered in this county. The hope is that if our landlords begin to understand these programs, that they'll be more eager to enroll in those programs and open up opportunities for affordable housing access to more residents. We've hosted 2 of these sessions, and the landlords that have attended, we hosted one in Charlotte and one at the Delta Township Library, and it gives landlords a direct opportunity to interact with all of the agency staff who run supportive housing programs and ask questions that they may have or talk about concerns that they may have and get direct feedback from those agency staffs and representatives. It's had really good feedback from that. The team also created a Mythbuster sheet that is accessible on our online website that helps landlords who may have a certain perception or idea or experience with an affordable housing program in Eaton County that may be limiting their eagerness to engage in an affordable housing program. And so we've got these really quick one-page Mythbusters to help landlords better understand how these programs work and what the parameters are. And our third action team is working on creating a universal referral and follow-up process for frontline workers here in Eaton County. What we've heard over and over from talking to frontline workers is that there's a gap in the time that they refer their clients to a needed services. They don't always get information or feedback back from that other agency to understand what happened to the referral, what comes next, And to help better coordinate care here in Eaton County, we've been working to develop a referral coordinator tool that is a form, a follow-up form that allows as referrals are sent, to get that referral follow-up information back. And we've also created a little database of all of the referral coordinators in Eaton County and the programs that they're running, and then the direct program referral link. So it's an easy tool for frontline workers to be able to know, hey, I have a person here sitting in front of me that needs access to this specific thing. They can find who that referral coordinator is, what agency they're with, and what the referral form is, and just kind of close that gap and make coordinating care a lot quicker here in Eaton County. So lots of work has been happening. It happens, all of this action team work happens within the HSEC monthly meeting. So we have shifted out or chiseled in time each month for action teams from agencies all over the county to really work together and move this work forward each month. So we're getting ready to enter phase 4 of the work. It will start with data sense making. We're going to begin the process of continuous learning and looking at the data that we've gotten from the radical listening process, and better understand the barriers that Eaton County residents are facing, and see what we can do together to make some of those conditions shifted. So, any questions for us?
Questions for Callie? Yep, Jim?
This isn't really a question, it's more of a history lesson. But thank you, Callie, for showing up and giving us it. This has come a long way. People here probably don't realize how big this is, because when I was elected in 18 and appointed to this collaborative council in 19 by Commissioner Augustine, it was the commissioner appointed to this agency or the committee that was the chair. And after a few months, it occurred to me that didn't seem right. To me, it seemed like someone from the council that was involved and actively doing stuff should be the chair. And so had a meeting with then John Fuentes, and we changed the bylaws. And so then Barbara Fulton became the chair. And that was probably the best decision I think ever happened, because Barbara started this process of creating this strategy for creating the collaborative council to be more effective. Because what was happening, the collaborative council would get together once a month, share, all the agencies would just share what they're doing and then go home. And it just seemed to me that there was a lot of overlap and there was a lot more that could be done. And so Barbara got to work, and she kind of started this, and I'm happy that you have kind of latched on and taking it. I don't know if you've taken it over, but you're doing a lot of work for it, and I'm really glad to see where this has come. So.
Thank you. Yes, it was transformational to bring in Dr. Penny Foster Fishman to be a consultant for our county. She's also this is kind of the best practice framework for really effective collaborative councils, and so it's been really transformative for Eaton County. And we're really excited to see this work become a regional best practice also. So,
Blake, did you have anything?
I was going to just piggyback on what Jim said. You know, I've been on this committee for 16 years, and I've been to the council meetings, the collaborative, the entire time. And this collaborative finally is making headway and becoming an effective tool. Yeah. And for all the years, it was always, oh my gosh, I got to collaborative. Now it's a whole different thing. Now action is happening. We're reaching out. I really want to applaud the landlord end. I mean, for years, we talked about housing, but we never talked to the darn landlords, the people that were responsible for supplying housing to the people in need. The county had no touch with the landlords in the county. It was like, well, wait a second. Don't we understand how the system works? I mean, people are in need of housing, and yet we're alienating all the landlords with our procedures and our processes when they actually should be our partners. And again, under Barbara and Callie, things have turned around and things have gotten better, and we're actually getting some positive results. And so I want to thank you for what you've done, and I think it's a great step and great improvement.
Thank you. That really speaks to the collective impact approach. That specific action team started with learning about the barriers to affordable housing in Eaton County, and then they surveyed the landlords in Eaton County. That was a couple phases of work ago, putting together a landlord survey to see what are the landlords hearing, or what are the landlords' needs, what are the landlords' barriers to helping us work together with us to increase access to affordable housing. And we heard from landlords in that survey that they wanted more information, that they didn't really understand affordable housing programs, that there was misunderstandings and miscommunications and sometimes bad experiences, and they wanted to have that touch point. And so this action team has spent that third phase of the work really trying to build a program that's specific to landlords. Those were hosted in person, those educational sessions, and we're looking at ways to now broadcast those, video record those, and make those something that landlords can just click on a website link and better understand a different affordable housing program as they function here in our county specifically. So,
Brian?
Yes, go ahead, Jeannie.
I'm on the landlord one, and it has been helpful. And once we educate this landlord and that landlord, and a lot of them will talk to each other, you know, down at the cafe or whatever. And so I like the idea, too, that they've been recorded. Delta Township doesn't really have a list, and so I found out who to talk to. It's the building inspector, not the enforcement workers. So we're going to work at having them watch a video or two. So, but this all came about being able to change this because there was funding through the Eaton Health Alliance or something. Callie, how did that work?
The HSEC right now is funded primarily through Eaton Community Health has made a commitment for at least
Right.
3 to 5 years of being able to help fund this work. And then we have also applied for grant dollars that has helped us move this work along. And so we have a small pot of money for the action team work, and that is what helps our action teams be able to host events and education sessions.
So that's why when we look at it, the way the county had it structured, we didn't have access to those type of resources to be able to hire the staff and the PhD and things like that. So now that they came to us and offered the support,
Yes, we have.
that's how it changed.
Yes, our HSEC now has a coordinator, it's a part-time coordinator, and that has really helped to transform how we're able to stay organized in this work
Right.
and keep this work moving forward. We have a staff member who is staying right on top of organizing everything happening within the action teams, announcing that out on a listserv, and really helping to keep us all on the same page and organized and aligned. So having a coordinator has made a very significant difference in the structure.
I was told also, like, I don't know, 20 years ago, under the Binsfield report, that there had been money to have Deb Klosterman or someone to do the coordination. And when that pot of money dried up, it fell a lot on our past controller, John Fuentes. So, and that was that way for probably 15 years. So then when the other funding stream became available, that's how we were able to move the mission forward to resemble this on a coordinated basis again. We had tried to get participating agencies, the first time I was in office, to all put in towards the coordinator, and we weren't successful.
Yeah.
So it worked out very nicely, and it's totally different. So, good.
Yeah. Thank you.
Thank you, Callie. And with that said, on page 11 of your packet is our annual blessing of this group. There are no general fund dollars allocated to this, but they do operate under our purview, so we do need an annual
Support.
resolution. Any further discussion? All in favor, please say aye.
Aye.
Any opposed? Very good. Thank you, Callie, for coming, giving us an
I look
update.
forward to coming back next year with more updates from this group. Thank you, Kim.
Very good. All right, we took care of the resolution. That brings us to the medical examiner service agreement.
Yeah, so the medical examiner per a couple meetings ago was sent out for an RFP. It went to 5 different communities and/or agencies. We just looked and saw who was doing the work in a circumference around Eaton County and sent it to those places. The only one we received back was from UMH Sparrow, which is who currently provides that service to us. And the amount that they are proposing is $390,000. So action would just be for staff to move forward in getting a contract with U of M Sparrow, if that's how you'd like to proceed.
Go ahead, Joe.
What was the amount before?
Just over 312. And we do have money budgeted for it.
I'll move it. Support.
All right. Any further discussion?
The only game in town, we don't have a lot of choices.
Please.
We need to have a medical examiner.
Yeah.
There's lots of legal reasons that we have one, and it's just necessary, and it's expensive business, moving, a lot of times just moving bodies around, so.
Well, I remember we used to have basically a part-time medical examiner for a long time, and then when we moved in this direction, the prosecutor's office was here to tell us how important it was that they have a professional with the assets that this organization has, so it is an expense that we need to provide.
Very good. All in favor, please say aye.
Aye.
Any opposed? Very good.
So when we have the contract, we'll bring that back with the resolution at that
Very
time.
good. All right, opioid settlement oversight committee. Anything to report? Looks like a couple pages.
Yeah, so the opioid settlement oversight committee met and reviewed all of the RFPs. There's a memo in your packet that gives the recommendations. The commissioners that sit on that committee are Commissioners Mott, Mulder, and Brailer. And then there are 3 community people who sit on that committee, one of which is Callie, who represents the health industry, being with ECH. And then there are a couple members who are either survivors of the opioid epidemic or family members of. And these are their recommendations.
I would say that the committee has done a lot of work over the last couple of years, formulating a process and creating methodologies for distributing these funds. And I want to thank everyone that was involved, especially the other commissioners. And I think we've reached a point now where it makes some sense. We had some pretty, we had 5 RFP. The RFP had 5 responses, and all of them, I think it was 5 or 6.
6.
5, yeah, 6. And all of them had merit. Amy Delinky has been a pretty good helper for us in terms of the guidance and making sure we stayed within the guidelines that backed the whole opioid settlement. And these 2 RFPs, I think, kind of hit the nail on the head for a couple of things we were looking for. And one of them is for Samaritas, which is a treatment, and Peer Coaches, that's right here in Shalat. And I think we all agreed that peer coaching was one of the important aspects of this, of the treatment process. And the other one was here with our own drug courts. There are some holes in their process when people are going to drug court and they're going through the process of substance disorder. And one of them is that they have to be tested, like random, routine, continual testing. And there was no funding for it, and a lot of it fell right on the backs of the person that was coming out of the drug court. And those people, you know, they're having a hard time. They're at work, they get called out of work, they've had substance disorder, and they've been, you know, their lives are a shamble. And you know, some benefit to help pay for some of this drug testing, which is ongoing and it's ridiculously expensive. But it's a big part of making sure that people are staying sober, right? I mean, you got them through drug court, you're supposed to monitor them for a certain time period afterwards, and you got to make sure that they're adhering, because we all know that people that have a substance abuse disorder basically will lie to you all the time. I mean, that's just they're part of the problem, and they need to be tested. And so this was one of the ways we were able to supplement that program. Another part of that was transportation to some of the housing units, the clean housing, and that was important for them. So, you know, these two programs are not wildly expensive, and yet I think they hit the heart of what we were trying to do. I wanted, in the very beginning, and we talked about this, was to have programs that actually touched Eaton County residents and supported the residents and helped them help themselves make a difference. And, you know, I didn't want the monies just to go to some nebulous organization that sucks down money and uses it in their own ways. I wanted this to actually have impact on Eaton County residents. And I think these programs have done that. I hope so anyway. And so this is our first step, and it'll be an ongoing process for future boards and members of this committee. And I think, I hope we've put the program on a good footing and foundation so that it will continue along these lines. So,
Very good.
and I'll move the resolution.
Or
Joe?
I just wanted to indicate that over the course of the last year and a half or so that we've been doing this, that it hasn't just been the three of us and staff involved. The entire community was involved in a number of different meetings, a number of different efforts. We got a lot of help from the health department as well in this endeavor. So it really was a community project. I think this is a good first start in terms of getting some of the money out into the community. Hopefully, the committee will meet again after the first of the year and put together another round in the spring and really start to set it up so that there's a continuing process. We have at the moment approximately $3 million or so that's supposed to last about 18 years. Hopefully, I've suggested in the past, and I hope the committee will consider and board ultimately taking the convention money that we now share with Mid-State for substance abuse services and roll that into this organization, this committee as well, which would be a substantial amount of money that would help to continue the programs and the processes that have been started. So this is a very good first step, and congratulations to all of the people who participated, staff, the public, people like Kelly who have volunteered to continue this. So.
Very good. Anything further on this? Go ahead, Chair.
One short thing is that we initially set a limit of 300,000, but we just didn't feel like we had enough good applicants to spend all of that, which is fine. We want to make sure that the dollars get spent effectively. So that's those dollars will just continue on for another year, and who's ever on that committee will have the opportunity to look at this again.
Very good.
I'm-
All right. Oh, go ahead, Jeannie.
I'm just happy that we looked at a program to help with the cost of the drug screenings that are needed, because a lot of times that also is obviously part of their probation. And if they can't afford it, and they're already losing work hours, it just creates another problem. So I'm happy to see that there was a consensus to help people with the cost of that drug testing. Thank you.
Very good. Let's go ahead and have our vote. All in favor, please say aye.
Aye.
Any opposed? All right, very good. Page 33 of your packet, you've got some committee appointments.
I'll move them.
Support.
Any further discussion? All in favor, please say aye.
Aye.
Any opposed? All right. That brings,
Congratulations, Mr. Mulder.
yeah,
Been appointed to something.
I know.
Can't wait. You get to look at the contracts.
That brings us to limited public comment. No one's rushing the stage, all right. And miscellaneous, anything? Who am I supposed to look at? Her? Okay, all right. Okay. Well, any other for a third chance of limited public comment? No? All right. That's all right. Well, we had to, there we go. We just covered our bases.
You can have that imperial look across the.
Yes, 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 across the vast green chairs. All right, we stand adjourned. Thank you.
Thank you.
Thank you, everyone.